eClinicalWorks recently visited MedPeds, situated in the DC suburb of Laurel, Maryland, which has delivered outpatient services to approximately 6,000 patients over the past year. Practicing since 1982, MedPeds is a private practice of 8 providers and 23 employees, committed to providing the highest quality combination of healthcare, compassion, and technology for a healthier patient. This commitment led to the implementation of eClinicalWorks' comprehensive electronic health record, directly improving the quality of patient care and positioning the practice for success now and in the future. We spoke with Dr. Seth Eaton, patient Heidi, provider Rima Jalali, physician Jill Rosenstock, and nurse manager Joe Ross, about their adoption of eClinicalWorks.
We adopted electronic medical records in 2004. I was part of the choosing of the medical records. It was a complex endeavor, and we chose based on a bunch of criteria and decided to go with eClinicalWorks because it seemed to suit our needs the best as primary care doctors.
We removed all the charts, and the staff had one trainer, and all of a sudden everyone had to use these electronic records. And really within 4 days, the entire staff had gone electronic.
I suppose the biggest advantage for me as a working mom with EMR is that I can take home most of my work. Traditionally, we would be in the office till late hours working on charts physically because your charts were, you had to go through each chart manually. And now I really can leave pretty much at the end of my appointment day, go home and remotely do most of my work. Now that I can see labs and x-rays and phone messages and really do most of my work that isn't actually seeing patients out of the office, which has been a tremendous advantage for both me and my whole family.
Nothing can match the access and availability of the medical records from home, from the office, the ability to review things with patients in a really time-appropriate manner.
I feel like it's a team here, and I have a primary care physician, but anytime I'm seen by any provider here at the practice, I feel like they are all on my side, and they have access to my records and can interpret the information consistently in a way that gives me the best care. As evidence that I really value this medical practice, I declined to be taken to the hospital at the site of the accident. I was conscious and felt like I wasn't in bad enough shape to go to the hospital because I don't want to be there. So I came immediately here to MedPeds and received urgent care, which is another service they offer, which I think is critical. It was for me that day. And I was carefully evaluated, and this information certainly was put into my record, and this healing process is a long one, and I will be back many times for the same reason, and the record has been clearly kept since that first day. Things that I can't even remember happening right after the accident, it's there in my record, so you know, nothing gets lost.
We actually have been part of some patient-centered medical home projects, and we're early adopters of the Patient Portal as well. That really has improved our ability to provide patient care.
I like having information at my fingertips. That's just how the world is. It's a Google world. And so when I want the most important information is about my health, and I have a test result coming in, or I want to remember when I had the last vaccination for something, I can easily go to my own medical information without having to ask anybody for it whenever I want and get the answers I need.
We've gotten the kiosk for there to be use of kiosk within the office, and we've been able to leverage the web portal, which we were among the first users, and we've been able to use the text messaging, which we really have found to be amazingly patient-friendly.
because we are so much more accessible, we have a lot more specialists giving us a lot more information, which makes all of our information more comprehensive. In addition, it's much easier for us to send office visits and to send labs immediately to specialists, so that when somebody goes to see a specialist for a problem that needs further recommendations, they really have a much better idea of what's going on. And I think can give a quicker resolution to the problem for the patient.
One of the really compelling features of eClinicalWorks now for us as primary care is the registry. And we use the registry to reach out to patients for issues that clinically patients don't always respond to a request to get a colonoscopy in the exam room. And we use the registry to reach out to patients who hadn't had a colonoscopy. And lo and behold, one did respond to our registry request, went ahead, got a colonoscopy, and thank goodness his colon cancer was found at a stage where it's totally cured. And this really, his life is saved because we had a registry and we were using eClinicalWorks to its full potential.
Currently, we're in the Health Information Exchange for the state of Maryland, where we upload patient information along with other hospitals in the area, and we're able to, view this information so that we can make the best possible clinical decision for the patient. A lot of times patients get discharged from the hospital or seeing other specialists, and it's very important to keep all hands involved when dealing with patients so that we know the best way to go about treating them. And through being able to share this information, we are able to find out so much more about the patient, and there's no loopholes in between, so we're able to take better care of the patients.
And thanks to really the technology we've been able to leverage with eClinicalWorks with electronic records, we are really proud to say we have won the HIMSS award. Yes. So we're really excited about how eClinicalWorks helped us get there.
eClinicalWorks and MedPeds, improving healthcare together.